Hello, everyone. Thank you for joining. My name is Tanoa, and I'm the NAF Social Media Coordinator. I want to welcome you to our AAC 2023 virtual session, Maharishi AyurVeda and Integrative Medicine for Ataxia. Before we get started, I wanted to mention a few housekeeping notes. Remember, you can ask questions at any time in the chat. We'll have our speakers available after the presentation to answer your questions. Also, if you missed one of our talks from the conference, don't worry. We'll have all the sessions available for on-demand viewing after the conference. With that out of the way, I'd like to introduce our speaker, Beth Ann Bitner. She's a third-year graduate student at Maharishi International University in Fairfield, Iowa. She's majoring in Maharishi AyurVeda and Integrative Medicine, a holistic approach to healthcare relying on both traditional and modern medicine. Ms. Bitner developed a passion for slowing the progression of ataxia through experimentation, implementing dietary herbs into cooking for a family member, and more recently herself. She was diagnosed with SCA-34 halfway through last year in 2022. She is determined to ensure ataxia does not prevent her from following her passion and dreams. Beth, thank you for being here.
Good morning, and thank you to Noah for the kind introduction. My name is Beth Ann. I also go by BA. And to literate on what Tanoa said, I am a third-year Maharishi AyurVeda and Integrative Medical student in Fairfield, Iowa. I live here in Southeast Iowa, and I am presenting Maharishi AyurVeda and Ataxia. And at the start, I would like to say thank you for everyone attending this morning. And also, thank you very much for the IAC and NAF for allowing me to present. And this is my first year at the conference, and this is also my first year presenting at a conference. And like Tanoa said, back in 2022, there's a typo. 2022, I was diagnosed with SCA-type 34, and I'm not letting that slow me down. I'm really not. I have decided to move on and just go about day to day and make accommodations as necessary. And also, if you have any questions regarding Maharishi AyurVeda or my journey through SCA-type 34, SCA-type 34 is not an ataxia really known out in the world today. Please feel free to add those questions to the chat, and I will do my very best to answer these questions. If not, I will find the answer and email you if you provide an email contact. Without further ado, let's get started. In Maharishi AyurVeda, we always begin with a wholeness. And the wholeness is basically just summarizing what we are about to discuss. And I am introducing that concept of Maharishi AyurVeda to individuals with ataxia and their providers with hopes of slowing the progression of ataxia. And as a disclaimer, my presentation is only for educational purposes. Please talk to your providers before beginning any alternative approaches to medicine. What is Ayurveda? Ayurveda means the science of life or the knowledge of life. Ayurveda is the oldest and still practiced form of medicine in the world today. It originated in India. And if you're familiar with yoga, you participate in yoga, whether it's chair yoga, vinyasa yoga. Yoga is a sister to Ayurveda. And it gives the connection to the mind and the body for an overall wholeness. In Ayurveda, we also use herbal remedies in lieu of pharmaceuticals. In Maharishi AyurVeda was founded by Maharishi Mahesh Yogi, and he is the founder of the Transcendental meditation technique, which is a technique I will discuss later on, back in 1955. And he utilized Ayurvedic techniques to revamp Ayurveda by adding the Transcendental meditation technique in 1985. And our campus in Fairfield, Iowa, was the location where Maharishi wanted for an education for Vedic, any type of Vedic education, whether it was, for example, any type of like medicine, like Maharishi AyurVeda, herbology, aromatherapy, and other Vedic tools. And his approach with Ayurveda, his overall premise is a term called pragyaparad, which is the mistake of the intellect. So anytime you are just off in your own world, thinking negatively, or you decide to drink a Coke instead of a water or anything like that, that is the mistake of an intellect. And I can answer more questions further on. And in Maharishi AyurVeda, his approach, just like at the university, they're at Maharishi International University, is the consciousness-based approach to health. And that is where the Transcendental meditation technique comes in. Maharishi AyurVeda is brought about by practitioners and Vaijas. My degree is a Maharishi AyurVeda integrative medical practitioner, or if you go beyond, that is the equivalent of an MD in modern medicine, which is called a Vaija. And we are not licensed. We're non-licensed medical professionals, but we have completed the necessary training. And there are two locations, actually. One is out in Los Angeles called the Doshas Center. And there is an Ayurvedic university out there as well that is not Maharishi, but is regular Ayurveda. And then, of course, MIU here in Fairfield, Iowa. Transcendental meditation. The technique is an effortless technique performed twice a day, sitting comfortably in a chair. And what you do for 20 minutes is sit there with your eyes closed and think your mantra. Now, since I am not a certified TM teacher, I cannot go beyond just a simple description. However, you learn TM through a certified TM instructor who has gone through, I believe it's 6 months worth of training. And there are results and research that shows astounding results. These results, they've done research in inner city schools, lowering the crime rates, to other, helps with veterans who come back from war with PTSD, and they have found astounding results. And I am going to take a minute so you could write down the two websites I have here for more information. You have the David Lynch Foundation, which has a lot of rich information about the Transcendental meditation technique. Or you can also go to tm.org for any other information. What is the difference between Maharishi AyurVeda and modern medicine? Well, our Ayurveda practitioners and Vaijas do work alongside your physicians, whether it's your neurologist, your physical therapist, your primary care provider, any of those modern medical professionals. And whatever those professionals say goes. So if your provider is okay with seeing a practitioner or Vaija, then, but however, for example, they say no herbs, or you need to make other accommodations for exercise or dietary or anything like that. Whatever modern medicine providers say goes. We have to follow what the providers say. And in Ayurveda, we focus on the whole health or the whole self. So instead of going in for the flu or going in for COVID or something in that nature, we look at the whole self. What is going on with you versus just we're here to cure one disease, one disorder, or something like that, of that nature. So what we look for in Ayurveda is two terms, prakriti and vikriti. Prakriti is what you are born with. It is the shape of your eyes, the shape of your nose, your ears, your hair color, your natural hair color, whether you're tall, short, big boned. That's what prakriti is. Vikriti state is what is currently going on with you. So, for example, in the pulse reading, which I will go on a future slide, in the pulse, we look for any disruptions in the pulse that could potentially signify an aggravation in a dosha, which can affect an organ, or ama, or anything of that nature. And what we look for also is your state of digestion. Sometimes you might hear Ayurveda practitioners known as the gut doctors. We focus on gut health. We focus a lot on gut health. And with gut health, we have the state of Agni, which is your digestive fire. And all those are also determined not only in the pulse, but through questionnaires that we provide prior to the appointment to get a better idea of the level of ama you're in, the state of Agni you're in, and also your medical health history form and any other family members, especially if there are family members with ataxia or Parkinson's or MS or heart disease, blood pressure. And we want to know in that health history form, your lifestyle, your dietary behaviors, just so we have a better picture of what is going on with you as a client. And of course, srotas, which is channels shrotas and dhatus and ojas. Shrotas are your channels. And look at a channel as arteries. Once the shrotas get clogged, it's just like what happens when an artery gets clogged. Your dhatus are your tissues. And your tissues, when you get anything chemically spilled on you, it can soak right into your tissues, into your srotas. And ojas, and a good example for ojas is your level of energy, your metabolism. If you have high energy, you have high ojas. If you have low energy and you're not feeling well, you're going to be tired, lethargic, and just overall not feeling well. Doshas. There are 3 doshas, and these are the nature, physiological makeups of the human physiology. The doshas, we work around the law of nature. So earth, wind, fire, ether. And the doshas are defined by vata as air and space, pitta by fire and water, and kapha is earth and water. Beneath those main doshas, you have your sub-doshas, which are the sub-branches of each dosha. And I've given an example for vata, which are the different sub-doshas under the vata dosha: prana, samana, udana, apana, and vyana. And the areas within the physiology of the body that each sub-dosha does affects. So, for example, for ataxia, udana governs the brain. Prana, when I say head and heart, That is your emotional state. Whether you're for your emotional head, are you thinking clearly? Are you positive or are you negative? Did you know that times of day have to do with the doshas? We have in Ayurveda everything broke down from your age to the time of day and how everything digests after you eat according to the time of day. And for somebody in my nature, for example, I will use, I am in the pitta time of life. So I am successful for pitta aggravations. Now, this time of year, with it being here in the Midwest, end of February, then we're in the Vata season still. The Vata is very cold, very dry, very moving. That's the Arctic air that comes in here up in the upper Midwest. Times of day and digestion. When we get to the dietary, I'll explain more, but our main recommendation is eating at our main meals at noon. And that is because the pitta time of day is 2 p.m. to 6 p.m., where you have a lot. If you feel during the day, hey, during the afternoon, I have a lot of energy and stamina, that is because it is the pitta time of day and it's that fiery dosha inside of us, working our way through digestion and giving us the metabolism needed to get through the day. Ama and Agni, I'm going to reintroduce the concepts. Ama is the toxins within the physiology. Now, Ama can be chemical, any chemicals that you're exposed to. It could be any air, the air you breathe. Now, if you live out in the country and you're exposed to a lot of agriculture that does spraying, crop dusting, it's up in the air, you breathe it in, that is considered Ama. And another example, Agni, which again is your digestive fire. And each dosha is signified by a different branch of Agni. So Vata is your Vishama Agni, your Pitta is your Tikshna, and your Kapha is your Mand Agni. But if you do have balanced Agni, which we all hope for, that's our goal for as practitioners, is to get your Agni balanced, you're considered Sama Agni. How does all this relate to ataxia? So what we are going to do, and the reason we have the health history forms, we are going to ask a lot of questions, is we want to know, is it genetics? Did you have a brain injury? Is it due to alcoholism, recreational drug use? But we also are going to look at your lifestyle and your routine. And whether, family history, going back, family history and genetics to me are two totally different spectrums, because ataxia may skip a generation. And for genetics, of course, mom and dad. And then maybe dad doesn't have it, but you have his brother who does have it. And that is why I've got them separated on here. So why in the beginning of my slides did I mention Vata quite a bit? Vata aggravation governs the neurological disorders in your brain. And Vata is the primary for your central nervous system. And of course, it governs the movement. Remember when I mentioned moving and I used the example of Arctic wind, movement, your coordination. That is all Vata. And so any of the diseases like SCA, Friedrich's, any of the other type of ataxias, this is a Vata imbalance. So I call this slide AAA, Ama, Agni, and Ataxia. So for Ama, you have the disruption of the gut-brain axis. And a lot of people are not familiar with the gut-brain axis, but what happens in your gut affects your brain. So for an example, if you're constipated, how do you feel? Do you get migraines? Do you feel your gait off? If your gait is off, maybe, and you notice that you haven't had a movement in maybe a day. That could be because there's a disruption in your gut-brain axis. And Vata is also, the seat of Vata is also in the colon. So in Ayurveda, once we have the interview, we've gone through the forms, everything, we are going to do a write-up. Most of us do. Now, I can't speak for everybody, but in general speaking, we have clinical write-ups. And our first and foremost is depleting the Ama and kindling the digestive fire or your Agni. We want to get rid of those toxins out of your physiology first and foremost. And then we move on to dietary recommendations. Now, along with the diet, and how do we determine this, is your Vikriti, your current state of imbalance. And that is read through the pulse. And if you're thinking pulse readings, such as here, we read our pulses just below the bony prominences of the wrist. We read the left hand for the men, the left hand for the women, right hand for the men. And with these three fingers, it's Vata, Pitta, and Kapha, and then the subdoshas go across the top of the fingertips. And that is how we look at implementing the dietary regimen. We look at your lifestyle, and we recommend behavior rasanas, and I will get to that in a later slide. And then we also have, multimodality approaches. And the multimodality approaches is where the transcendental meditation technique comes in, yoga comes into play, Vedic Vastu, which is Vedic architecture recommendations. There are all sorts of Vedic technology that we can recommend or implement as long as it's okay with your neurologist, your primary care provider, or any other modern medicine providers. The behavioral rasayanas. And this is more of think about it more as staying positive, living positively, giving overall outpouring bliss, love, compassion, cleanliness, personal hygiene is very important. And other things such as, being positive, ataxia. I will admit personally, I have had my moments. I can get really frustrated with myself when my gait is off, or I can't enunciate properly to present in a clinical webinar for school or something of that nature. So you've got to find ways to keep yourself upbeat, keep yourself positive, and push through your day. And most importantly, rest, relax. It's going to be okay. Dietary, once again, it is based on the Vikriti. Recommended meal times. Now, this all comes into play with, for example, if you're a provider and you have to be in the clinic for surgery at 7:00 in the morning. Each diet, we work with your schedule, but mostly, generally, your recommended meal times are 7 and 12 and no later than 7:00 at night. And generally speaking, between 5 and 6, depending on also evening activities and other commitments. But lunch is your main meal of the day. That is your heaviest meal. That'll give you the energy to get through the rest of your day. And when it comes to cooking in Ayurveda, we always recommend fresh, organic goods. And some foods can be aggravating for some doshas. But we will work with you and explain to you what can and can't do and give you some recommendations from there. If you open up your spice cabinet, you'd be surprised how many Ayurvedic herbs are in your spice cabinet that you can cook with. Another recommendation for easier digestion is to soak anything overnight, such as seeds, nuts, and grains. And then, most importantly, when you eat, turn off your cell phone, turn off the TV, keep yourself distracted free, close the laptop, and you want to be mindful of what you're eating. Avoidances. Avoid snacking. A lot of it is when you have your 3 meals each day, typically you want to give yourself about 6 hours for proper digestion. So anytime you snack, you can interrupt the digestion process. Processed foods, microwaving your food, undercooked or overcooked food. Limit red meats, so like lean chicken. We are more of a vegetarian based, but there are like lean chicken or other lean meats. Avoid alcohol if you can. However, I will disclaim with alcohol, if you are wanting to cut back or quit completely, work with your modern medical provider and do it easily. You do not want to put yourself in a detox state. That can kill you. And then, of course, cold beverages for Vata being cold, Vata imbalance. You want to drink warm beverages, like warm herbal teas, warm water with lemon. Lifestyle, routine, and multimodalities. Live blissfully. Be happy. Live each day just live each day. Your routine, create a routine that works for you and stick with it. Avoid screen time after 8:00 at night to help you get ready for your nighttime routine to get a full night's sleep. Now, there is, of course, a little bit of leeway if, of course, you're having a bad ataxia day and you need to lay down. We generally do not advise napping during the day or laying down or anything like that. But given the case, it is okay. You need to rest. You need to rest. Listen to your neurologist. I cannot emphasize this enough. Whether it's your neurologist, your speech therapist, your occupational therapist, listen to them. Follow their leads. And anything, if you were to see any of us practitioners or Vaidya and they have information to relay on, let us know what limitations you do have or restrictions. Panchakarma. Panchakarma is a treatment protocol for refreshing and rejuvenating the body and mind. This is done at a facility we have what is called the Raj in Fairfield. I have not personally experienced it, but they have Vaijas and technicians there on site. And depending on your case is the recommended amount of time that you would need to be in clinic. And generally speaking, with Panchakarma, you're going to be considered an inpatient. And I'm going to use that loosely as in modern medical terms, inpatient, where they have rooms available where you stay and they have meal plans set up for you, everything. Your Vaija will have everything set up and the treatment protocols to help you deplete what is going on with you. There is a home protocol with before you go in for Panchakarma, where you do have to deplete the Agni, kindle the Agni, deplete the Ama. But everything else is done there at one of the Panchakarma clinics. And they are worldwide. There are tons of Panchakarma clinics in India. Some people go to India, or they come here to the Raj in Fairfield. Now, I provided a case study on Shirobasti, which has been shown to be beneficial in ataxia patients. There is signs of improvement, but more research needs to be done. And that is where maybe down the road, I'm looking at doing research. So it's something down the road we need to see just to have an idea of, it doesn't work for everybody. Everybody's physiology is different, but it's just curious to know how well the Shirobasti would work. Now, an example I would use for something such as a Shirobasti is Dr. David Perlmutter. He is a renowned neurologist, and he's also in whole health out of Florida. I do not know to this date if he is still practicing, but he has several books out, such as Brain Grain. Brain Grain is a book that was introduced to us in passing, just as a recommended book for our course, just to read for leisure. And it is a very good book. But that is an example. Dr. Perlmutter would give enemas in clinic to help reverse like migraines or any other like improvements for MS or anything like that. That is what a Shirobasti is. It's an herbal enema. One downfall to Panchakarma is very expensive. And with Panchakarma, we do not take or accept insurance, and it is very, very pricey. Whether you're there for 3 days or for ataxia patients, the recommended time for ataxia patients, according to the research studies, is about 21 days. Research. I went through PubMed, and I go through PubMed. I also utilize UpToDate for any modern medical information. There are research articles out there. Not a lot, but there are research articles out there. And one thing that really I'm going to emphasize again is this direct quote. Over the short period of the present study, Ayurvedic therapy was found to be safe and showed improvements in the balance of patients with progressive degenerative cerebellar ataxia. Further randomized placebo-controlled double-blind studies are needed to validate the results. More research is needed to be done. And that is why I approached the NAF to see if I could present and introduce a new concept, just to introduce it and see if anyone is interested. There is another quote. about the Sarah scores for gait and stance. There was improvement, quite an improvement. For me personally, on the home front, and that's right here in my house. With a family member, I have snuck some herbs, and everybody's different. I cannot share these herbs because what works for one person does not work for somebody else. I slowed his progression down. And all I did was cook with the herbs. And his former neurologist, who is now retired, even commented that his progression had slowed down. I was not at that personal appointment, but that is what was relayed to me by other family members. And thank you again for listening. At this time, I am happy to do the best I can to answer questions. If you have any questions regarding SCA-type 34, a little bit of a background with SCA-type 34 is my family was one of 3 families in the world originally clinically diagnosed. And that was a few years back. And now I believe we are up to 13 families in the world with SCA-type 34. And that is what really, after what I went through in 2022, I apologize for the earlier typo, it was 2022. I had to do something. I'm a very proactive person, and I am hoping I'm going back to the modern medical side, and I'm going to be studying human biology and medical science post-graduation in June. With Ayurvedic practitioners, I will leave at a closing with this. The United States is divided when it comes to holistic medicine. So I live in a state where it is not, practitioners cannot just go out and open their own clinics. You have to be with a licensed medical provider that would offer these type of services in order to practice. So I could work in a hospital. I could, I am also researching on options of assisting individuals in health freedom states. Health freedom states such as Minnesota, where the National Ataxia Foundation is, you can open your own clinic. You could do, it's free, and there are some other states involved where you're in that state. I just need to sit down and figure out what I could do. Right now, I'm also gearing more towards the educational side of it versus actually practice. But, the sky's the limit. So I can do, I'm just still outweighing possibilities and here in the next 7, 10, 20 years. And thank you for listening. Are there any questions? And thank you again for the National Ataxia Foundation for allowing me to present this year, and hopefully maybe see you all next year. Thank you.
All right. Thank you so much, Beth Ann. I know a lot of people just came over from the last session that I was on. So we're going to do the Q&A. Looks like we have some questions in the Q&A already. And I did see a couple in the chat. So as you're answering these questions, I'm going to go up and make sure that we get those ones that got asked. If you have any other questions, put them in the Q&A. That way we can make sure that Beth Ann gets to answer them. Raquel asks, where in Los Angeles was the location for one of the other schools that you had mentioned?
Hello there. Now, am I able to share my screen?
I don't know if you're able to.
Yes.
Oh,
Okay,
yes.
thank you, Stephanie. I do have some information up. So the address I am going to, this is off of our school's website. If you can all see the expansion of the screen, it's right there in West Los Angeles. I believe it's over by LAX.
Okay.
I have not personally been out there yet. There's a lot of COVID protocols. But the address, let me see if I can highlight this, or I can also copy and paste that and put it in the chat if I'm able to do so. Let me
I think you should be able to do that. And then I went back up and found the question I seen at the beginning. Denise asks, are you an herbalist? And then also, is it covered by insurance?
I will start with the second question first. We do not take insurance. A lot of your alternative medicine fields do not take insurance. You know, maybe for example, like an acupuncturist would, or maybe a chiropractor, but nothing in the form of like Ayurveda, a health coach, anything under that spectrum. No, we do not take insurance, unfortunately. The question about the herbs. We are heavily educated on the herbal remedies, different types of plants that, you know, can be used as herbs, but we are not specifically titled that. No.
Okay. Let's see. There was another question about is there a recommendation to stimulate do you recommend laxatives to stimulate, like to initiate like a bowel movement?
Unfortunately, I can't really discuss that at this time. That's only primarily because everybody's physiology is different.
Mm-hmm.
So with Vishama Agni, there is a protocol to help kindle the Agni, which will help move the downward movement, and do the, help balance the subdoshas, Apana and Prana and Nose. But I can't give out specific herbs only because of, you could have maybe a Tikshna, which is a more pitta-based Agni imbalance. So it's really hard to differentiate without speaking to each individual specifically.
Yeah. And I think maybe, talking to your general practitioner would be someone that can help you decide if that might be a good idea for you.
And that is thank you, Tanoa. That is very highly recommended. Please, if you're interested, I am doing all this as an educational tool. We're everywhere in the world where it's legal. There are some countries that ban Ayurveda, but talking to your modern medical provider first is key. Saying I'm interested in this holistic approach to medicine. However, I would like to discuss options with you first. And then, if you get the approval, you come in and see one of us, whether we're labeled as a health coach or a practitioner, or anything of that sort. We will give you, me personally, I would give you a full clinical write-up. And then I will take, herbal recommendations. I will have that written down. However, you need to talk to your doctor first, or your neurologist, or anyone who is your primary to oversee your healthcare. And just in case, if they have any questions, I'm always the practitioners, I could speak for myself, always free to cooperate very well with modern medical providers.
Yeah, that was something that I found really interesting when we did the initial recording, was the talk about holistic approach. And and recognizing the two sides of it. So very cool. Looks like someone asked what comforts you. I'm not 100% sure, what they're looking for that answer, but is there anything that you find comforting that you would be able to share?
Are you speaking on, if they're speaking on the SCA-type 34, I take it easy on bad days. I am a very heavily active person. In the respect to, I am a multi-sports competitive athlete. I love doing my races. What I have found out with the SCA-type 34 is that I have to I can no longer run the full duration of a 5K, 10K, half marathon. I have to do a run walk. So, but I still go out and I enjoy. This year, I have implemented mountain bike, going back to my mountain bike, and I'm actually working closely with a PGA pro to begin golfing again. And with mild symptoms, I just trigger, I just keep in the back of my mind what triggers my symptoms. And I'm more mindful that way. So if I'm sitting here just psychoanalyzing a putt, for example, in golf, the longer I look down, the more symptomatic I get. So I just have to keep that mindset. And other comforting things, I'm in school. I'm at 2 schools this year. I start at a new school in the fall. And other comfort are my 2 fur babies at home. I've got 2 cats. Just enjoying life, enjoying being with my nephew, and I find it very comforting.
Yeah, keeping a positive mindset, and yeah, that makes sense.
Exactly.
Looks like we had a question about good spices to use in cooking. I know that you're limited in your ability to talk about that, but whatever, maybe you can share ways for people to learn more about Ayurveda, maybe on the website or.
Yeah, definitely. A lot of herbal remedies that are cooling, because pitta is that fire, that dosha of fire. And when you think of fire, you think of flames, an actual fire. That is, your acid reflux, your indigestion, like that is your pitta. And so if you're having heartburn or anything that's a burning sensation, that is pitta becoming imbalanced if it's not already fully imbalanced. And anything that's cooling. Now, I'm not saying go out and do ice water. No. And but just without specifically saying my specifics online, just anything that's like a cooling in nature. Maybe a couple cooking herbs. I cook a lot with fennel seed.
Okay.
That would be a very good example to start with. And unfortunately, I cannot specifically dictate herbs right now.
Yeah. Yeah. Looks like, oh, hi, Sharon. Sharon wants to know if you have any experience or knowledge of treating people with Crohn's. She has Crohn's in addition to late onset cerebellar ataxia and is on low dose chemo for Crohn's. She knows that the drug makes her ataxia worse.
We covered Crohn's. We have covered Crohn's in school. I can't specifically answer those type of questions. I graduate June 24th, so I'm not official yet, but I am happy to discuss things. I do also have to be careful because I do live in a not health freedom state. Right now, being in Nevada, Nevada is a health freedom state. However, everybody's case is different. I do have to be careful on what I say and do right now. I am happy, Sharon, to talk to you. And Tanoa, is there a way to copy and paste her email address or a way for us?
I can send it to you.
Okay, no, I appreciate that because I'm also reading the Q&As. It's just, I don't want to sit here, just start copying and pasting while I'm sharing the screen.
Yeah, no, that makes sense.
Thank you very much for your help. I appreciate it.
Yeah. Another person asked about herbs to lower blood pressure, but I think that goes back to what we just talked about. I
have covered HBP and cardiac. I will emphasize, sorry to interrupt, Noah. We have covered the main conditions, main neurological conditions, main cardiac conditions, main renal connection, conditions and such. So I do have the background knowledge. But unfortunately, I am very limited right now what I can say and do.
Yeah, makes sense. Looks like that's all the Q&A questions right now. I do have a couple of other ones that I just will mention briefly in the that were in the chat. Maria asked, will the presentation be provided on the NAF site? And then thank you, Steph, for answering in the comments, but it will be available for rewatch within the virtual platform all the way up until May 1st. And then after that, it will go on our YouTube channel. You can find us at Ataxia Foundation on YouTube. That kind of goes back to another question I saw. Gail wanted to know how to join the NAF Instagram. Follow us at Ataxia Foundation. Again, that's our main handle where you can find us on most social media platforms. We are almost at 1,000. I think we're within 10 followers from hitting 1,000. So that's really exciting. We created the Instagram a year ago, and to get 1,000 already, it's super exciting. Some of our first posts were about last year's virtual conference.
I do want to I'm sorry to know. I do want to comment on, I know we see some former or current athletes with ataxia in the chat. I'm not seeing them I'm not reading through them specifically, but one thing I have done is make a lot of adaptations. So for my mountain bike, for example, I took my bike back to the shop that I purchased the bike at, and they've lowered the saddle bar, and the saddle bar is your seat. Saddle is seat in bike terms, and they lowered it down as far as they could go. We've changed the handles up, so when so I'm not like completely slumped over like this or looking down a lot. And one reason for the saddle bar lower is just to, if I have a spell while riding, I can quickly brake and slide right off the saddle without tipping the bike.
Yeah.
And one thing for hiking and running and racing and stuff, my running team is I have a group that I run with once a week, and they are used to seeing me with hiking poles. So there is adaptive equipment out there, and there are days I just can't do it. And that's okay. That's okay. So learning to accept what you can and cannot do, and just taking it easy on days that, are not so great.
Yeah.
But no, I'm happy to see all these comments in the chat, and thank you very much for the questions and kind words.
Yeah. Yeah, it looks like that might be the end of the questions. I'm just gonna, I do see one from Maria. Are you in Canada? You're based in Iowa, correct?
Correct.
Yes.
I live in Southeast Iowa, about an hour southwest of Iowa City. I'm 45 minutes north of Fairfield, 45 minutes north of campus. And I do frequent Minneapolis quite a bit. So I'm between Iowa City area and Minneapolis on, almost a monthly basis.
Yeah. I actually met Beth very briefly last year at the walk and roll in Minneapolis. I got a good photo of her, and it was really nice to meet her again here at Vegas for the conference. So I just want to thank you all for joining the presentation, and a special thank you to Beth Ann for the presentation. I thought it was really cool to see a different perspective and learn more about Ayurveda.
And please feel free to email me, or if you see me at the conference, I will be at the conference after the lunch hour. Please stop me and ask questions. And as I said, I will do my best to answer within my scope of practice, but also of what I can and cannot share.
Yeah, sure. All right. Well, looks like it was just a couple minutes early, but thank you. Thank you, Sharon. Thank you, Joel, Ava, Peter, Raquel. Thank you all for joining. It was great conference. And we look forward to seeing you at some of the other sessions. All right. Thank you. Bye.
Bye.